Did you know that not all dementia is Alzheimer's? In fact, millions of people are treated for the wrong type of dementia, and many families don't realize it until years later. Doctors around the world report that nearly 4 out of 10 dementia cases are first misdiagnosed. One simple misunderstanding causes most of the confusion. According to the National Institute of Health, dementia is not one disease. Two of the most common types, Alzheimer's and vascular dementia, are very different but often mistaken for each other. Vascular dementia and Alzheimer's disease are the two most common causes of dementia in people over the age of 60. But they are not the same illness. They have different causes, different warning signs, different progression patterns, and mostly importantly, different treatments. The World Health Organization and the National Institute on Aging both emphasize that correct diagnosis is critical, because what helps one condition may not help the other. In this video, I will explain 7 clear differences between vascular dementia and Alzheimer's disease in simple English. Difference number 3 is the one most people and even doctors often confuse. Now let's begin. Difference number 7. How fast the disease progresses. One of the biggest differences is how symptoms change over time. For Alzheimer's disease, decline is slow and continuous. Memory and thinking get worse little by little. Families often say every few months something is slightly worse. Vascular dementia, decline happens in steps. The person may stay stable for months, then suddenly worsen after a stroke or reduced blood flow, then remain stable again. Medical journals like Neurology report that this step, like decline strongly, suggests vascular dementia. Simple rule: slow and steady decline, Alzheimer's; sudden drops, vascular dementia. Difference number 6. What goes wrong first? Different parts of the brain are affected first. In Alzheimer's disease, memory is affected early. Forgetting recent conversations, repeating questions, losing items often. This happens because Alzheimer's first damages the hippocampus, the brain's memory center. Vascular dementia, planning and decision making decline first. Trouble organizing tasks. Difficulty managing money or schedules. Poor judgment. A study published in Alzheimer's and Dementia Journal so that early executive problems often point to vascular causes. The key takeaway: memory first means Alzheimer's, planning and thinking first is a vascular dementia. Difference number 5: walking and balance problems. In Alzheimer's disease, walking problems appear late. Physical movement stays normal for years. Vascular dementia, walking problem often appear early. Slow walking, balance issues, increase risk of fall. Research in the Journal of the American Geriatric Society found that early walking problems increase the likelihood of vascular dementia 4 times. If walking changes appear before major memory loss, vascular dementia should be considered. Now, difference number 4. What brain scans show? Brain imaging gives strong clues. For Alzheimer's disease, MRI, PET scans, shrinking of brain tissues, especially in memory areas, overall brain volume loss. Vascular dementia, sign of past strokes, white matter damage, reduced blood flow, multiple small brain injuries. The National Institute of Aging confirms that MRI scans can clearly show these differences. Now, difference number 3. Heart health connection. This is the most misunderstood difference. In vascular dementia, directly caused by high blood pressure, diabetes, high cholesterol, smoking, heart disease, these damage brain blood vessels. According to the Lancet Neurology, controlling these factors can prevent up to 40% of vascular dementia cases. In Alzheimer's disease, not directly caused by heart problem, mainly linked to age, genetics, protein buildup in the brain. You can have perfect heart health and still develop Alzheimer's. Difference number 2. Response to treatment. For Alzheimer's disease, may benefit from donepezil, rivastigmine, galantamine, memantine. These help brain chemicals temporarily. In vascular dementia, focus is on blood pressure control, stroke prevention, diabetes management, and cholesterol treatment. NIH research shows vascular dementia may stabilize if blood vessel damage is stopped, something rarely seen in Alzheimer's. Difference number 1. Prevention. For vascular dementia, largely preventable. WHO states up to 80% of strokes are preventable. Prevent strokes means prevent vascular dementia. In Alzheimer disease, no proven prevention. Healthy lifestyle may help overall brain health, but no guaranteed prevention method exists. This makes vascular dementia unique. It is the dementia type we can actively fight. What you should do next? Number 1. Never accept a dementia diagnosis without knowing which type. Second, ask for brain MRI, cognitive testing, stroke risk assessment. Third one, if vascular dementia is suspected, control blood pressure aggressively. Manage diabetes and cholesterol. Fourth, if Alzheimer is diagnosed, discuss appropriate medications. Plan long-term care early. Fifth, remember, mixed dementia is common. Many people have both. Which difference surprised you the most? Have you seen this sign in someone you love? Share your thought in the comments. If this video helped you, please like, subscribe, and share it with someone who needs this information. Accurate diagnosis saves time, preserves function, and changes lives.